Covering news that matters. Fox 23 News at 9 starts right now.
Oklahoma gets a D grade when it comes to infant and maternal health in the state. That's according to a recent report card by the March of Dimes. Thanks so much for joining us at 9. I'm Shay Rozzi.
And I'm Nathan Thompson. Glad you're with us. Preterm birth, prenatal care, infant mortality, and maternal mortality. That's what March of Dimes looks at every year. And infant mortality remains a major concern in the country and right here in Oklahoma.
Fox 23's Paris Rain joins us live in the newsroom after talking with local nurses in the neonatal intensive care unit at Ascension St. John Paris about their day-to-day with these babies and their families.
Yes, Shay and Nathan, bringing a new life into the world is a beautiful thing, but when there are complications, that's where the NICU nurses step in and fill in that gap. And while the grade for Oklahoma looks scary, the work that many nurses are doing here in Oklahoma and at Ascension St. John's NICU unit is what they hope will change the grade for next year.
In Tulsa, like across much of the state, those numbers represent families who are facing uncertainty, unexpected hospital stays, and sometimes heartbreaking losses. That's where NICU nurses come in.
We are that transition for making sure that babies go home with parents, they're healthy, and they're going to thrive. And there's nothing better than when we have a sick baby or a tiny baby and we are all involved in the care, and then weeks or months later, then the baby goes home. That really is what we want.
Elaine Bakes is a registered nurse at Ascension St. John. She says no mother has it in her plans not to take her baby home after giving birth. But there are times, Elaine says, when a baby needs more care.
And no one can duplicate the touch of a mom and a dad. That's typical, that's the parents. We're just here as extra hands and eyes to make sure that everything goes well with the baby. And if there are problems, we can recognize them and start taking care of them before they become serious.
Nurses like Ashley help families oftentimes when the birth journey doesn't follow the original plan. And for her bedside care, educating families and helping future nurses, she was recently awarded the March of Dimes Oklahoma Neonatal Pediatric Nurse of the Year.
It's important to teach them that, it's okay to touch them. They are still your baby, even though you're not allowed to do, A, B, and C, that's still your infant. What you're doing is still important. You're still a big part of this for them. Nothing is as important as your touch and you being here. So we just kind of help to fill that gap and to allow them to do what they can while still keeping baby safe.
The March of Dimes annual report card shows 5 different health conditions that lead to preterm birth or experience other poor birth outcomes like smoking, hypertension, unhealthy weight, diabetes, and hypertension in pregnancy, the highest being unhealthy weight.
These babies are tough. They are way tougher than adults. They fight through some of the craziest things and the outcomes are amazing. Even when you think, oh my gosh, this baby is so little, they're just fighters. Just to watch them go from like 1 pound nothings to these awesome little kids it's so fun. It's the best.
While Oklahoma and Tulsa specifically are ranked low, Oklahoma is currently implementing 4 of the 6 supportive maternal material of infant health and initiatives included in this report card of this year. If you want to learn more about the policies and procedures and more information on this year's report card, we have a link in this story on fox23.com. Live in the newsroom covering news that matters, I'm Paris Rain, Fox 23 News.